So a mammogram is not a perfect test. Mammograms do miss some types of breast cancer. And in patients who have dense breasts, we know that mammograms may miss half of the cancers that are present. So we do know that this modality can be supplemented by the use of ultrasound, which is not limited by dense breast tissue. Patients often ask, why can't you see masses very well in patients with dense breast? And I say it's kind of like trying to see a polar bear through a snowstorm. You're trying to see something white that's on a white background. It's just very difficult to detect. There's only one way to know whether or not you have dense breasts, and that's get a mammogram. You can't tell based on size, you cannot tell based on feel, you cannot tell based on age. The only way to know if you have dense breasts is to get a mammogram, and then we can make that density assessment at that time. Our density assessment is also assisted by a computer analysis which tells us what density it thinks the patient's breast tissue is. And so that kind of helps across multiple readers make a more less subjective, more quantitative assessment of that breast tissue density. Dense breast tissue not only reduces our chance of seeing breast cancer on a mammogram if you were to get it, it also is an independent risk factor in and of itself. Something like a family member or first-degree relative who's had breast cancer, a risk factor on about that same level. So it is something that we definitely want to pay very close attention to in terms of being a risk factor, in terms of limiting the efficacy of the test, a mammogram, and in terms of identifying who may benefit from some additional screening tests such as ultrasound.